When faced with the decision to remove a tooth, the long-term consequences affecting your oral health must be taken into consideration and evaluated. When a tooth is removed or lost, the neighboring or surrounding teeth compensate by shifting into the empty space or gap. This shift in the tooth's position can result in a less than ideal dental alignment and can cause potential gum or bone recession. This can also lead to an excessive buildup of dental plaque that can eventually develop into more severe gum disease. This change in your tooth's positioning can also lead to TMJ, or temporomandibular joint disorder. This is what normal positioning should look like, while this is abnormal or dysfunctional positioning displaying pain and distress. If left untreated for a long period of time, spacing of the teeth may occur. Rather than removing a tooth, your tooth can be prepared for a dental crown or be replaced in the form of a dental implant.